Hey everybody! In today's video, I'm sharing the best way to care for your baby's umbilical cord from birth through the stump falling off. And I want to make sure that you know the best way to clean your baby, the best way to dress your baby, to keep babies safe and really promote care of the umbilical cord. We'll also cover when you might need to worry about the umbilical cord and when you might need to seek help from a pediatrician. Also, I want to bust some common umbilical cord myths that are lingering in society. You might believe in them as well, and I'm going to share those at the end. So I recommend sharing this video with your partner and maybe even any family members that might be questioning how to take care of the umbilical cord. After the baby's cord is cut at birth, there will be a small section of that cord that comes out of the baby's belly button, and that's what we call the stump. I know it's kind of a gross word. The stump doesn't have any nerve endings, so the baby doesn't feel any part of this process. The stump is going to change in color, so it'll probably start as like a dark yellow, and it might end up eventually being black as it dries up and falls off. So that's the normal process, and this process takes around 5 to 15 days. Now, don't panic if it goes longer than 15 days. When it does fall off, it's normal to see like a little bit of blood. There might be some crusty, dry blood. And this is a spectrum of how it works. So there are some differences. But as long as you're not seeing any of the concerning signs, then things should be fine. So let's talk about these signs. These are ones that if you notice, it might mean that your baby has an infection in the umbilical cord. So you're looking for things like if the baby has a fever, if there's redness around the belly button, or if that skin is kind of swollen, if there's a lump, if you see yellow or green pus coming out of the belly button, or if you see that foul smell at that site, then if you're noticing any of these with your baby, I recommend that you call your baby's doctor, and they might want you to come in and have a look. So I don't want you to get to the point of an infection. So taking care of the umbilical cord stump is actually really easy. Let's first talk about how to clean the baby. Now, this is where you might hear or read some conflicting information. For many years, it was recommended to clean around the stump with an alcohol solution a few times a day. You might even have a grandma or an older family member that's giving you advice on this is the best way to do it. But research has found that this is not the best for baby. That alcohol may actually kill the good bacteria, which is found around the cord, that helps it dry and detach earlier. So no alcohol for the stump. Instead, you want to keep the stump dry. So what this means is avoid submerging your baby in a bath, in a tub. So you don't want to do this until the stump has fallen off. So if you need to clean baby, use a washcloth, give a sponge bath, and avoid getting that umbilical cord area wet. If the cord gets wet or dirty, pee or poo, clean with a really mild soap using a washcloth and then just pat dry. Now, you might notice some crusty blood around the cord sometimes, or even some like clear secretions. That can be wiped off with fresh water and a washcloth. A small amount of blood is fine and very common actually, but if you see more than that, you want to call your care provider. Now, when it comes to cleaning this area, it's really less is more of a strategy. During this process that, like I said, can take up to 2 weeks or maybe more, you might get impatient. You might want to pull on the cord or pick on the cord, but no, don't do this. It's important to be really hands-off when it comes to this process in order for it to heal properly. So now let's talk about diapering and dressing baby. When it comes to diapering and dressing, a less is more strategy is also the way to go. Now, I'm not suggesting that you let your baby go without a diaper, of course, that'd be pretty messy, but it is important that the diaper not cover that umbilical cord area until the stump has fallen off. And this can be tricky, especially if you have a tiny baby or if you have a premature baby. There's a few ways to make this work. So with disposable diapers, you can fold the front of the diaper down before you put it on. Put the tabs on with it folded. Also, you can use diapers that have a newborn cutout, has a little notch in the top that makes it easier to not cover the stump. So many brands of newborn sized diapers have the cutout. So popular brands like Pampers and Huggies and Amazon's Mama Bear Gentle Touch, I'll link down below. Now, if you are using cloth diapers for your baby, I highly recommend getting enough disposable diapers to last until the stump falls off, because with the cloth diapers, it's really difficult to fold them down low enough to not cover the belly button, the stump, and that makes it harder to keep dry. And I'm speaking from experience here because this was a mistake that I actually made with my 4th child. Now that we have diapering covered, let's talk about how to dress your baby for optimal health and care of the umbilical stump. You might be tempted to dress your baby in cute clothes that you purchased recently or received from family and friends, but again, less is more is really the strategy here. You want to skip tight clothes like onesies that your baby will eventually spend time in, but I would really go with just a diaper if you can most of the day. And you can keep baby warm by wrapping them in a loose blanket. And just remember, skin to skin is still really beneficial to baby even after you come home from the hospital. So if you're holding baby skin to skin, it's really a win-win here. You get all those benefits that come with skin to skin, the bonding, the brain development, and you aren't putting clothes on the baby, so the umbilical cord has that access to air and it'll allow the stump to dry faster. When you do want to dress baby, consider like those loose fitting gowns or the kimono style button shirts. And if you're not sure what I'm talking about, I'll put some links below to those as well. Okay, so I ran across a product recently on Amazon that was called a umbilical cord belt for babies. It's like a small piece of fabric and Velcro that goes around their umbilical cord, and I definitely don't want to recommend that. Definitely avoid that, and you don't want to cover the stump with like a bandage or anything. It's gonna look gross, and that's normal. It is. You might want to pick at it because you see it. Don't. Just leave it alone. Less is more. I know I mentioned that I was gonna bust some umbilical cord myths, and these are good ones that I still hear. The umbilical cord does not attach mom to baby. So the cord actually attaches from the baby to the placenta. Then the placenta is attached to the mom's uterus. I have the baby right here. I'll show you guys. So baby cord to placenta. And then the placenta is inside, growing to the wall of the uterus. So when the placenta comes out after the baby, there's no cord attached to the mom. This is something I think that is really confusing for a lot of people. So hopefully we busted that myth if that was one that was in your mind. Now the second myth is a big one, and I hear it a lot. It's whether you or your doctor can impact whether your baby has what's called an innie belly button or an outie belly button. Now I've heard people say that the doctor didn't tie someone's umbilical cord right, and that's why they have an innie or an outie. First of all, the umbilical cord, it's not tied, it's just cut, and the body closes at the point where the cord attaches to the body. So there's absolutely no tying involved. And the appearance of your baby's belly button is something that no one can control. It's dependent upon the way that your baby's body is made. Hopefully that's a myth that's busted for you. Now, taking care of the umbilical cord is easy. So don't forget to alert your doctor if you see any of those signs of infections that we went over. And if you would like to learn more about the actual cord cutting the cord, I have a great video right here that will answer the internet's top 20 questions on cord cutting. And if you're still preparing for birth, I know that you'll like to see my video about positions to make labor faster, and that can be found right here. Now, thanks for joining me today, and I'll see you guys next time. Bye.